Warning signs usually wake us up, and the signs of diabetes are no different. In my opinion, the signs of type 2 diabetes can be like a silent storm. The reason why I say a silent storm is because sometimes there are unsettling things going on that you don't even notice. But sometimes you do have those signs that may get you to go see a physician. And for many, a physical exam is well overdue. So what are the signs of diabetes? Well, I'll give you the generic ones, the ones that everyone will probably tell you to look out for. And then I will give you the real signs, because I think most of us humans are wired in such a way that we only take action when things get so bad that they're painful. But I suggest a more proactive approach. Here are the common signs. These are the signs and diabetes symptoms that most of the doctors that I work with has said that they look out for. If someone comes in with maybe flu-like symptoms, but then starts to say that they have noticed increased thirst, increased hunger, fatigue, increased urination, especially during the night hours, weight loss, blurry vision, sores that take a long time to heal or don't heal. Now the above are signs or symptoms that something isn't right in the body. But in my opinion, the real signs of type 2 diabetes are obesity, being overweight, and lack of exercise. To me, these two signal that if we don't make some changes, not only will we have to worry about type 2 diabetes, but a whole slew of other health problems. Let's dissect each one and how they relate to type 2 diabetes, because if you have these two handled, there's less to worry about when it comes to type 2 diabetes. If you're overweight, especially that pear-shaped abdominal area, visceral fat, you're probably at risk for insulin resistance. Now, although insulin resistance doesn't always result in type 2 diabetes, for the most part, type 2 diabetes almost always presents itself with insulin resistance. So just by losing weight around the midsection, you can reduce the chances of type 2 diabetes. Lack of exercise is a big one. If you're a couch potato, you're setting yourself up for type 2 diabetes. Why? Because being a couch potato is usually the next domino to fall right after poor diet when it comes to developing type 2 diabetes. Just think about athletes or anyone who's extremely active. It's harder to be a type 2 diabetic if you're active. In fact, many athletes are guilty of having the worst diets out there, but they usually feel that they can eat whatever they want, so as long as they stay active. I can go on and on about how lack of exercise contributes to type 2 diabetes. In fact, it's the reason why so many type 2 diabetics are now kids these days. Before the 1990s, this was unheard of. Kids who were diagnosed with diabetes almost always had type 1. But with the rates of kids' obesity these days, this is no longer the case. Now 50% of kids diagnosed with diabetes have type 2. Scary. All because of decreased activity these days, not to mention poor diet. For more information on type 2 diabetes, visit diabetesdietcures.net now.